the interview, everyone. And today I'm privileged to have a guest by the name of Chao YuHu. And Chao is a nursing graduate of approximately 1.5 years, Chao, and she's working in Manitoba. So Chao, welcome.
Hi everyone. My name's Chao. It pronounced like the Italian goodbye, Ciao, just in case you wonder.
And maybe tell us a little bit about yourself, Chao, where you are from and where you're nursing right now.
Yeah, for sure. So I work on the internal medicine unit named GH4, Health Sciences Center, HSC, in the city of Winnipeg, province of Manitoba, since October 2022. And I casually work outside the city in the different health regions since September 2023 as part of that provincial float pool by Share Health.
Or did you say float pool?
Yeah, so it is a new initiative around 2, 3 years ago, I want to say. So you kind of go outside the city, work in different health regions in Manitoba.
Oh, that's interesting. How did you hear about that?
Yeah. So I actually heard it from I would say, family friends. And then there was a healthcare career website in Manitoba. So I went down there and applied there and then started working for them.
Oh, that sounds very interesting. I'm sure there will be a lot that comes out in the interview around your working as a float nurse and the challenges and the inspirations of that practice area. Um,
Definitely.
so Chow, are you from Manitoba?
So I am actually not, but I've been in Manitoba for almost 10 years. So I call this my home. I'm originally from Taiwan. I came as an international student when I was in high school. But yeah, I feel like this is my home and I'm privileged to work here.
Wow. Well, let's just jump right in. Why don't you tell everyone a little bit about your transition to practice? Maybe start with how ready were you to graduate? So, what was your preparation for transition? Did you hear about the transition experience? Tell us a little bit about that.
Yeah, sorry. It's actually kind of interesting because in school we actually utilize your textbook or like your theories of nursing transition. So yes, my school did teach me about that. My personal transition was graduate and healthy because I work on the same unit where I did my senior practicum for 3 months. But with that being said, I transition, I believe, will never be a straight line. I feel like it's like driving on the roads, right? You hit the potholes here and there. There's always something. So, and to be fair, I would say it took me a year and a bit more to settle comfortably on my unit. It didn't take me a year, to become competent to do my job, but feeling comfortable and doing your job well are two different things. When I first started working, because I worked on the unit before, so my orientation were shorter. So I believe it was 7 days of day shift, not altogether, of course, and 7 days of night shift. However, my unit staff, and this includes like healthcare aide, allied health team, they were very supportive, of course, nurses, charge nurses. And the area where I work, we have 24/7 medical staff. So the city is blessed with the resources, and I'm grateful for it. So yeah, that's kind of my personal transition.
Mm. I really
Yeah.
appreciate your pointing out the fact that it took you a year to feel comfortable. It's not that it was stressful every day of that year, but like the theory identifies, it does take a full 12 months to kind of come full circle and say, yeah, I'm pretty comfortable now. Would that be accurate?
For me, yes, but I have definitely heard people that, especially with the international educated nurses, it could take them a little bit longer. Sometimes also depends on the personality too. And I found myself, I'm loving the area I'm doing. So it's almost like that feeling, meeting the love of your life. You just know like this is where you belong. So I think that kind of helps with the transition too.
Oh, that's a great point. So talk a
Yeah.
little bit about where you do work. Talk to us
Uh,
about
so
the area.
Yeah, for sure. So, the unit, like I say, is GH4. Some people in Manitoba know it as a hell for, because that unit used to be, full of the staff that's, may not be the nicest, but that culture is changing. I would say happy for anything if now. So it's an internal medicine unit. So sometimes we do get surgical patient, but basically any medical condition from head to toe you can think of it, we have it. It is a unit between ICU, below ICU. So sometimes we do send patient to ICU. If we have stable patient, we send them to subacute unit. So kind of like your typical DKA, liver failure, renal failure, cancer, we get them to a lot of syndromes, some metabolic. But yeah, there's so many I can name, but I think that I love medicine. I love drug. So, and I like a lot of hands-on. There's a lot of wound care too. And just that idea of admission and discharges, and that you get to see your care plans. So I know some area they have high turnover. I mean, we do too, but not as high as a day or two. Yeah, so that's kind of where I work.
Well, it sounds like it's got a little bit of everything.
Yeah,
Yeah, yeah. Makes you a jack of all trades.
hopefully.
Well, actually, it sounds like a good place for a graduate to start, because the minute you start to get too narrow, sometimes you can lose that sense of the synergy between systems, and the fact that an individual that might come in with renal failure likely also has a cardiac element and a hepatic element, and mental health challenges and family issues. And so it sounds like a good place to get that holistic sense of practice.
Yeah, I would say that too, but that's not to say I always believe that if you put me in a different unit, I'll be as, hectic as ever. Like, I don't know how to deal with pediatric, mom and baby, that kind of stuff. And I believe, like nursing is so dynamic. Don't be afraid to move around. You can start somewhere like subacute and move your way out to acute. Some people from my unit goes to ICU and emerge after. So yeah.
Fabulous. Now, you said that you felt quite supported
Yeah.
in the unit where you transitioned. And what did that look like? Like, so for you to say, I felt really supported, what does that mean?
I think that is the idea of having a environment and unit culture that you can say, I'm struggling, I'm overwhelmed, I need help. Can you do vitals for me? And not to worry that people will look down on you. And knowing that, um, yes, asking for help is not a sign of weakness, but knowing your weakness is also very important to prevent mistakes. It's not like you ask for help and you expect other people to do everything for you, but when you ask for help, you expect them to assist you along the way, but you finish off that knot, if that makes sense. So, yeah.
Yeah, I love that. I love that adage. Asking for help is not a weakness. And in fact, asking for help shows your strength, because you have confidence enough to say, I don't know this and I need some assistance with this. I think that's one of the qualities that makes a really good new graduate and transition to practice.
Yeah, and just practice, practice and reflect. So, yeah.
Well, how do you reflect? Tell me about that.
So for myself, I'm a visual learner and hands-on. I think that the hand and my brain kind of ties together. So I keep a journal for myself, because sometimes it's really hard to see the changes when you are in it. So I do keep a journal, and I kind of wrote down, like interesting diagnosis of medication I've never seen before, and not just about the patho, but also about like other simple thing like how I feel today. Did I overreact? If I had a very sick patient, do I feel like the debriefing went well? And then also just kind of chat with your colleagues and to kind of know, oh, this is actually not uncommon. They gone through that as well, and just kind of learn what their strategy is, but then put it in your own words. And yeah, so that's kind of how I reflect, and just know that, you can never fix anything. Like, we don't fix. We try to, be along with people's journey and try not to take everything so personal. So, yes.
And how did you come to this particular approach to reflection? Was it something, do you use a framework? Did someone talk to you about how to reflect? How did you learn that? It sounds like a great framework.
I feel like I don't know the name of the theory, but I probably learned some of that from the theory. But I think I believe that after graduation, what I realized is not always books that we learn from. Yes, they are important, but it's often the experiences that we have opportunities can gain from ourselves or others that stay with us. So I think a lot of time I think people model the way for me. Like, we have some great nurses. My preceptors, they were excellent. Church nurses, people in that leadership position really have that charisma. So, so I think that's yeah, how I learned from.
Did you did you find a mentor, or were you given a mentor?
Uh, so when I did senior practicum, they give you preceptor. So I didn't get to choose. They just kind of give it to me. So yeah, if that's kind of
And is that the individual that you normally went to when you became a graduate and registered nurse in the area?
So it's kind of funny. So yes, so the when I was doing my senior practicum, of course they are nurses, right? But senior practicum is only for 3 months. And after I finished my senior practicum, one of my preceptors, so my mentor, actually went to dialysis, so she was no longer on the unit. And that was kind of sad, but there were also other, staff there, like very informal mentors on the unit. So yeah.
Yeah, sometimes those are the best mentors, is the
Oh yeah.
who are the ones that you somehow feel connected to, but
Approachable.
assigned. Yeah, and that you
Yeah.
feel approachable. Yeah.
Yeah.
Oh, so if you're a new grad now and you're parachuting into an area and they haven't provided you with mentorship or a particularly assigned individual, how do you suggest to a new grad that they go about getting that kind of support?
I think now you mention it, I think HSC did have this initiative of like mentorship program. I saw it on the whatever their monthly news, but I didn't really sign up for it because I already had a lot of, informal mentors. But I would say for new grads, I'm hoping wherever you work, like you have educators that you can go to. I found that really helpful. And maybe look out at your site. Maybe they have this mentorship program, but you are just not aware of. I found that sometimes people are very quiet about those things. I don't know why, but I would say look it up. And then when you're in school, right? So you have your student advisor. I would say you go to them as well. And just kind of talk around, like, asking for, I know some people are doing, like myself included, before I even started on the unit, I did some shadow shift. Even though I was there during my third year of medicine rotation, I was there for a couple months, but I still did shadow shift anyway. So yeah, that's kind of my suggestion. So I hope that's helpful.
Now, these shadow shifts, they were assigned to you? Were you paid for them, or did you just say, I'd like to go and
No, yeah. You email the unit manager and just say, hey, I'm interested in perhaps working for you. This is kind of my area. Would you be okay to do like a 4-hour shadow shift and stuff like that? And I did that with ICU as well. So, and it was fun.
Yeah, great idea.
Mm-hmm.
Suggestion. Is there anything in particular in terms of the support that you were missing that you would have appreciated?
For me, particularly, is that scheduling and payroll aspect. I know it's not super like nursing directed, but I found it really difficult, or maybe I was just too busy, but the definition of overtime? What do you mean by banking overtime? How do I request time off? And how to read your paycheck? So I found that was kind of missing. And important because after a certain amount of time, I think some of your whatever your overtime would just get paid out, but then you could have a days off to decompress. So I think that was missing, and I would appreciate it. But for nursing wise, I mean, like sometimes the unit was short staff. I wish they were full staff, but sometimes unavoidable. Sometimes people calling sick. Sometimes I think sick calls are burnout calls as well. But anyway, so for me, that's what was missing.
Okay,
Yeah.
that sounds pretty good then. Maybe we can talk a little bit about what the most challenging part of transitioning from being a student to being a graduate was for you, and how did you cope with that particular challenge?
Yeah, so it's I pictured myself, when I graduated as a little golden retriever puppy, just learn how to walk and still unsteady and stumbling at times. What's more, I believe there were times I was too proud to say I was struggling. I remember the first year, even sometimes now I wonder what type of patient I will have, not being to rest still on my breaks and going home after work thinking about what I might have forgotten to say or do. So I think that anxiety was up a lot because now you're a real nurse, people are looking up to you. But I think the best way, and I kind of mentioned that before, is to cope is to submerge myself around my trusted and supportive colleagues who can handle a quick vent. Sometimes there's no solution to an issue. You just need to talk it out loud and, just listen, just need to be a listener. And I think that recalling the reason why I chose nursing, helping patient and family get through the toughest part of their lives. And whatever you do, they appreciate your kindness. And I think that, like I mentioned before, this is also the area I love. So I think that's my motivation there. So, yeah.
Do you have a particular situation you could share with the grads who are watching that gives them a sense of something that you struggled with, and then how you managed it or didn't manage it and reflected on it? Do you recall a situation? Maybe where
Yeah.
you were like, oh boy, that wasn't the best choice, something like that.
Yeah. Listen, I can just tell my year was going good. It was actually 2 days before my 1 year of nursing. I was like, whoa, like 1 year, right? And so that day was a weekend. So the unit was short staff at baseline. My assignment had a lot of IV antibiotic, dressing changes, etc. Anyway, there was one patient I remember had brain tumor, stage 4. Basically should be palliative, but wasn't quite ready yet. So he was receiving radiation treatment. A little bit confused on and off, but he was holding it. Wife was there, very nice. And then I had the other patient who was very tasky, and need me a lot when they actually don't. So so I was kind of juggling between back and forth along with my, every 4 hour antibiotic, etc. So and then so I walk off the a patient's room, and then the medical resident called me and was waving me over. I was like, what are you doing? Anyway, so and he told me that he believed my patient might have like a seizure or something. I was like, what? You didn't pull the call bell, like emergency call bell. Anyway, so I went over there and found my patient's eyes roll over and was breathing like very shallowly. I would say between 8 to 12. Definitely a big change just from before. But thankfully the attending was there. So we treated him, give him a lot of Narcan. That was one of the medication we give, so much that my colleague had to go to the other unit to grab more. And so everybody was helping out, of course, but I really would like to be with my patient, be that primary nurse right there. Anyway, my charge nurse Marcy was about to give that naloxone, putting her gloves on, and I still remember vividly. I say to her, Marcy, I can give that naloxone, and she just looked at me ever so gently and say to me, Chao, I know you care about your patient, but we got this. And then I just started crying nonstop because I was so tired. I was so drained. It's 4 p.m. in the afternoon. Everything just kind of went. So I couldn't stop crying. So I went back to the staff room, and then that was the worst day of my nursing career so far. But thankfully, one of the nurse was able to come early to do a 4 hour shift extra. So she was helping me out with the assignment. And then after that day, I was so tired, but I had time to reflect. So that was kind of my experience. And I'm sure everybody has something similar to it as well. So yeah, so that's me right there. I was terrible that day. I didn't do a good job. And I say that.
So why do you think you didn't do a good job? Do you feel like you missed something? What happened there?
I feel like I was trying to please everybody when I couldn't. And I should have asked for help earlier instead of waiting until later. So that's something I learned. And learning to set boundaries sometimes is very important and know your priority. So yeah.
And I'm so glad that you brought that up, because that exact situation happens to every single new graduate, right? Because they're trying so hard to fit in. They're trying so hard, and they want so badly for people to accept them and say, wow, you're such a great nurse, that they do have a hard time sharing, even sharing how they're feeling, sharing the stress that they're under, sharing the overwhelming workload, and
Mhm.
therefore not reaching out. That's so common.
But just knowing that, you know, like I said before, even the most senior staff will send out an SOS. So why can you, you
Mm,
know, right?
absolutely. Absolutely. So that's wonderful to get that message out for
Yeah,
them. Now,
definitely.
was the transition what you thought it was going to be?
Uh, Great question. For my personal experience, I would say yes, school did emphasize, on the theory aspect of, that professionalism and everything. And like I mentioned, I was fortunate enough to be, trained by, great preceptor in my senior practicum time. But with that being said, I believe there's a twist to it, that professionalism or per professional, whatever. But I think that when you started working, you would know adding just the right amount of that human-like interaction or human aspect to it will make your nursing recipe so much more tasteful and special. Uh, you know, I really believe that once you started working, you see yourself differently and nursing practice differently. So yeah,
What do you mean by differently?
differently in terms that you see yourself on different perspective, and then for myself that I try new thing, and then I'm surprised I like it. So yeah, and then yeah, just different way of looking at things. From you learn from your patient, you learn from your medical service. You're not always right. Sometimes you feel like you're talking to a wall. Communication something we can all work on it. So yeah, that's kind of what I meant. That makes sense.
Yeah, it totally does. It feels to me like this process of becoming a nurse, and this process
Yeah.
of learning more about yourself. And what I'm hearing loud and clear from you, which I think is a great message for all new graduates, and that is learn from everyone around you. This idea of not taking it personally. Most of the time, I would suggest, if you feel an affront from someone, it's about them. It's about the
Mhm.
fact that they're under their own levels of stress that you don't know anything about, or they're busy
Yeah.
and they can't respond with that human component that you talked about, but that doesn't mean that they don't have that inside them. And this idea
Yeah.
of having that and sharing it is wonderful.
Yeah, you got it.
So now maybe tell me a little bit about how well you feel your education prepared you to practice as a nurse. Do you feel like it gave you what you needed, or what's your perspective on that?
I think yes, the school did give me what I needed for basic competency level. But like I say, once you started working, you know, yes, you would still need to study. Like, listen, like I feel like people have this like idea of, I finished school, I don't need to learn anymore, but that's just not true. And then but yeah, you still have books to learn, you still have module to learn. School cannot teach you everything. It's just impossible. You'll be school for 100 years. And then so yeah, so you still have to learn, but the school tries to prepare you for that basic, entry level competency. So I think my school did, but it's more fun once you started working. So yeah, you're a nurse, you have your own taste of things. So
And that is very true. I mean, the intent of an undergraduate education or a certificate program is to teach you what you need to function safely in
mhm.
in an environment, not to take on patients that are highly complex, or not to necessarily be able to deal with a crisis situation if you've never dealt with one before. That's where the learning in the workplace comes in.
Yeah, the school builds you some foundation, but it's up to you how much more you want to build on it. So yeah.
Yeah. And just on that note, is there anything in particular, like of all the things that you went into practice and you're like, oh boy, didn't know about this. Is there anything that you feel that we could have done to prepare you better in your education?
Mhm. Good question. I would say that perhaps the communication aspect. I know, like in school, we're taught a lot about like communication, how to de-escalate a patient, but it's really, I don't think it's, anybody's fault, but it's just those things you just have to deal with it, like in action, and then you will get better at it. Like how to communicate with patient and families when they are, like the emotion are very high. How do you de-escalate that? When you have somebody in mental health crisis, how do you deal with that? How do you talk to your coworkers, right? So I feel like that part wasn't really emphasized, but I mean, like there's a lot of things to learn. So they did, teach us about that, but talk about, workplace bullying, how to reach out for help. But for me, communication, yeah, I think that's kind of the only thing I would say. It's always something I can improve on. So yeah, that's
You know,
kind of
it
my
sounds
take.
like a perfect place for sim, quite honestly.
Oh yeah, I think
Great.
people just get a little bit awkward with sim. But yeah, I remember simulation are fun. It's stressful, but it's fun because it's a safe environment. And then even after you graduate in my facility, they do this workshop every 2 years, just kind of to refresh your memory on, cold blue, like how to de-escalate, that kind of stuff. So yeah, check out your site. Maybe they have some uh online or in-person educational shop, and they usually pay for you to do those. So yeah,
Great, great suggestions.
yeah.
Yeah. And so just as we tie everything up, what do you think is the biggest change you've noticed in yourself since you graduated?
I mean, the age and the dark circle under my eyes seem to expand. So some avoidable physical changes. But yeah, truly, I really believe the respect and the trust. Your patient and your colleagues, and this include everybody on the team, for you really have grown. It was not like they are not respectful before, but you could sense that, your verbal and your non-verbal aspect of your nursing are really serious parts of patient care, and people are looking up to you, and you have a say. So without all that being said, I believe new grad, can you believe you modeled the way already when you started working? Like unconsciously, because I do. So that's why I have noticed. So yeah.
Mm, that's a nice thing to notice, sort of that coming into yourself as a professional, really.
Yeah.
And so, final word, what advice do you have for students that are about to graduate or grads who are struggling, perhaps?
Sure. I'm sorry, this may be a little bit long, but I would just say what I have here. So for all the new grads out there, thank you for choosing this profession. It's truly rewarding. But something just to keep in mind when you first started working. It's like we mentioned before, it's okay not to feel okay or say no to favors. And this doesn't reflect poorly on yourself. When we first started, I remember we tend to please our colleague or manager, right, by working some obnoxious hour. I just want to say again that nursing isn't easy and can be demanding. But that's not to say like not to work completely, but just to speak out when your assignment were abnormally heavy, and don't be shy to say, oh, man, I'm overwhelmed and burnt out, you know? And secondly, knowing and using your resources and be flexible and dynamic. Don't be fixated. You know, nursing is never like that. Healthcare is never like that. Asking for help and learning to delegate if possible. My lovely charge nurse Marcy and my other nursing colleague on H4 remind me every day that even, you know, the most senior staff listen to our SOS. And for example, the assurance that your medication calculation is correct, or a second set of eyes to make sure that a new skill is done correctly can really help build that confidence to feel more comfortable. And working as a team, I believe, does wonders for safe, effective, and efficient patient care. And really ties to my previous point, never think you're alone. And please don't be your own worst critic because you reach out for help. I know it can be such a learning curve to act kind to yourself, but you know, just remember that. And also creating a work-life balance that works for you. You know, if you work too much, sometimes it's so easy to get too engrossed in all the frustrating thing going on in the healthcare system, you know, for example, working short, not having support supply for yourself or for the patient, right? And sometimes it's really important to leave work at work. This doesn't mean we don't care. We're just trying to preserve ourselves so we can keep caring and not get defeated. And I really encourage everybody, just try to sit down and ask yourself honestly, do you really know what work-life balance means? Or does it just sound like the same polished term you heard over and over again, right? So what does it mean to you? For me, it means listen to jazz music or walking alongside a beach, something like that. Partially anyway. But on the other hand, you know, you could just love nursing. That's all you want to do for your whole life. So you can devour yourself completely. And that's fine too. And I will also say that to stay curious and compassionate and be open to things you may never consider. I know we just started working, but I just want to put that out for you. You know, you might surprise yourself. So like I mentioned before, I started working for the provincial floor pool under Share Health. Last summer, and this casual position has led me to travel the roads I would have never been to. I learned how to cruise drive. Wow, crazy, right? And met my colleagues like miles away who impact lives like crucially and humbly every day. They continue to inspire me to be a better nurse no matter where I work and being grateful for what I have. And that attitude to maintain high quality nursing care should be the same for all years of nursing services. And just remember that all good things makes us a little bit nervous. So shout out to whoever is just trying out or stepping into a new adventure. You're on the right track when you feel this way. Keep going. And knowing that kindness is contagious and it starts with you. Treat people the way you want to be treated. My charge nurse Marcy again once told me that culture can be quite different, you know, on each unit, but yet one should never go against the grain of nursing or medicine. And respectful workplace. Be kind to your colleague, even they just started a month behind you. Don't get too caught up because you work in a specific or specialized area. You know, I know there could be a limit to one's capacity to add to their workload, you know, with learners, and it can become frustrating. But remember your very first day. You know, I know you just graduated, but you could have students from, you know, college or university, you know, a group of them, right? So remember that and reflect on that. And that finally, remember to promote yourself and know that you have so much to offer, even when you don't see it in yourself. And that's why a journal could be helpful. And everyone has different strength. We need each other to make the unit and frankly, the world to function well and a better place. So that's my word for you. Thank you.
Oh, Chao, it was a wonderful interview. You shared so much that was very personal. Your humility is inspiring, and I look forward to big things from you in the future.
Oh, thank you so much. Yeah, thank you guys for listening and joining us.
Thank you, Chao.